Hey, for my GoFundMe, I'm asking for the money for the picl treatment because my alar and transverse ligaments are damaged. I have a digital motion X-ray or two of them that show that. No MRI doesn't really show it, but I can also feel it. In the back of my neck, it's like where your mouth is, but straight back your C1 is. Um, the ligaments that keep that from rotating are damaged, and the ligaments for keeping it from moving back and forth are damaged. So it sits more forward and it's twisted. And I went to the upper cervical chiropractor to get that fixed. I must have gone 80 times, and I've went to 8 different chiropractors. Maybe I've been 100 times. I don't know, but um, and they haven't been able to like. It was at about 20 degrees, which 8 chiropractors told me is the worst they'd ever seen. And now it's about 10, and it won't go beyond 10. And each time it's moved back further to where it's supposed to be, um, with the chiropractic adjustments, then my symptoms are less. Like the tinnitus is quieter, and I have a constant ringing in my ears, and I also have like if I lean forward and just hold that position for a little bit, like a few minutes, I get a really high pitched sound, which if you get a constant high pitch, you can get a constant high pitched sound from your vertebrae pushing against nerves, like your spinal cord or whatever. I don't know what exactly, but I've seen it with car crash victims where their C1 is a little off. It's squashing against something, it's moved off that, it stops. The constant high pitched noise is only if I lean forward. Sometimes it clicks on and then stays on for half an hour, a few hours. Sometimes it's only a minute or two. It's really frustrating when I'm trying to cook or eat or anything or trying to focus. I generally try to maintain good posture, but sometimes I can't see down. I need to look forward. I need to move my head down sometimes to bend over. Sometimes I'll bend over to pet a dog and my ears just start screaming. It's really frustrating. I also know it's related to my C1 because when the chiropractor adjusts me, temporarily I'm at about 5 degrees and that stops happening. Um, but then after a few days it goes back to 10 because the ligaments aren't holding it in place. So I need a picl treatment, and of course it's $12,000 or $10,000, around that. Well, it depends. It's not one set price. Depends on the person. So I need the money for that because it's so bad that I can't function at work. Um, like I can't move very well. I can't do much physical stuff without having to turn my head and all around a lot and bend over and move it a lot. So it's really frustrating. Also, for my internal jugular veins are squashed by the C1 because it moved forward. So it's normally your internal jugular veins are touching your C1 already. So your C1 has like these two wings on either side of it, and they poke out like left and right. Um, when it's more forward, like they're on the like this side of it, and when it's more forward, it pushes against them, and then it creates a block. So I have like the right one is completely blocked, the left one is mostly blocked. The right one, I've developed some collateral veins. However, when I exercise and get my heart rate up, the tinnitus gets much quieter, like to the point where I can't even hear it. And then when my pulse slows down again, when blood flow is reduced again, it doesn't have enough pressure to get through. Um, so then it builds back up and starts going through the collateral veins again. Collaterals meaning they're just the other veins that take a twisty turny way down the side. And there's a couple of them there, and they're small. They're over maybe more towards, well, definitely more towards my ear, and then back down, and they drain out through the bottom of my neck. But when they do that, tinnitus is much louder, and that's it's debilitating. It really is. I lost my home. I was gonna get 20 acres in an animal rescue, and that went out the window. I had a good job, and I haven't been able to work for more than a year. and I want to get back to it because it's horrible living like this. I'm also doing neck curve correction because my neck's straight, but that's only gonna take it so far. Those ligaments still need to be repaired, and I'm doing exercise, but depending on the severity of the damage, exercise will only help so much. Like if you have a damaged like ACL or something, sometimes you can do physical therapy and fix it, but sometimes you need surgery or replacement or regenerative therapy in my case, because there's not like I don't think I've ever heard of any surgery where they go and give you a ligament replacement for your um, alar ligament and transverse ligament, because they're inside the C1 vertebrae, so they'd have to get inside the vertebrae with surgical tools and reattach it. I don't know if that's ever even been attempted. Maybe, I think at that point they just give you a fusion. They don't bother with that because I don't think the technology's there to do that. Otherwise, I'd opt for that. Why not get a new one? But so I get regenerative therapy or maybe a fusion. And the fusions have a lot of complications too. And I've seen some bad ones. But PICL is like, it can help a lot. Sometimes it can not help a lot. But usually it doesn't hurt. Usually it doesn't cause problems. So I'd really appreciate any help you can give me. Sorry for going on, but it's a complicated issue with the veins and the C1 and the ligaments and how it's affecting my life and why I need the help. I'm still trying to work, but every time I try to work, I can't focus on work because I'm so stressed and I have trouble sleeping and the noise in my ears. So I need help, and my family doesn't have the money for it. I mean, no offense to them, they just don't. Well, some of them do. Not my immediate family, but what are you gonna do? You know, they're not interested. So, so if you can help me, I'd appreciate it. I know it's a lot of money I'm asking for, but I mean, if everybody that's ever seen me gave me $5, I'd have twice as much as I asked for. So I don't need, a lot from everyone. But yeah, thank you.